Talking to you by way of introduction on behalf of the Chief Nurses of Sussex. As Chief Nurses across Sussex, we have always worked closely together as a system, but it's fair to say that over the last few months, in responding to the coronavirus pandemic, that we have grown even stronger, and that bond between us has certainly become stronger. So, on that basis, when we started to have conversations about International Nurses Day, celebrating the birth of Florence Nightingale on the 12th of May, and indeed this year in 2020, that it is the International Year of the Nurse, because it's 200 years since Miss Nightingale was born, then we talked about the fact that we wanted to celebrate that together. We may all work in different organisations, but I think it's become really apparent to all of us that we are all part of the same family.
The greatest heroes are those who do their duty in the daily grind of domestic affairs, whilst the world around them whirls like a maddening dribble. Never were the words of Florence Nightingale more relevant than they are now, 200 years since her birth. The world is facing one of the biggest healthcare challenges in over a century, and the NHS the biggest challenge since its creation.
On the 12th of May in 1820, Florence Nightingale was born, and at the age of 25 she became a nurse, and as we all know, that changed the face of nursing. 200 years later, we are celebrating nursing as a whole community across the world.
Florence Nightingale is probably best known for her work during the Crimean War in the 1850s, where she realised that more soldiers were dying from their diseases, such as cholera, than their actual injuries. In these extraordinary times, it's never been more important to focus on the fundamentals of Florence Nightingale's work, especially infection prevention and control, the provision of physical and psychological support, and truly holistic care to all those who need it.
Whilst we are all trying to adjust to living and working with COVID-19, one of the many positives to emerge has been the incredible sense of community and kindness from all walks of life and in all corners of the world. The weekly act of clapping for key workers and the appreciation shown to NHS workers in particular is both humbling and emotional. It demonstrates the depth of feeling that people have for the NHS and importantly for our staff, and the amazing professional bonds that we all share.
As Chief Nurses across Sussex, we wanted to join together in the spirit of this new sense of community and working together to thank each and every one of you. Acute, community, integrated trusts, mental health and specialist services, providers, commissioners, old friends who have come back and brand new ones who have joined our NHS family. In these incredible times, we as Chief Nurses think it is more important than ever that we celebrate the day and this year, and it will likely be one that the world will remember for quite some time.
We recognise all of the amazing and compassionate care that you're providing each and every day, and the incredible innovation that you're taking forward at these challenging times. We're not able to celebrate in the way that we all want to just yet, but we're looking forward to easier and better times when we can.
A huge,
Enormous,
Genuine,
Emotional,
heartfelt
thank you.